Hi everyone, my name is Morgan Watkins. I'm a reporter with the Courier Journal, and here we have Governor Andy Beshear to answer your questions. Nearly 200 Courier Journal readers sent us questions, so Governor Beshear, thank you for doing this, and let's get started, see how many we can get through.
Well, thanks for having me, and you know I have to start the same way every time. Folks, we're going to get through this, and we're going to get through it together.
Absolutely. So the first question, we got a lot about unemployment. So we've heard from readers who've been waiting over a week, even as long as 3 weeks for a callback on their requests for benefits. What kind of wait times should people expect in terms of getting questions answered, as well as once they're approved, actually receiving benefits, especially independent contractors who are newly qualified?
Well, this crisis is one where we want to make sure that everybody has enough to get through it. It has upended our economy in a way that we have never seen, and we will restart. We will rebuild this economy. We'll get back to a place where we don't have the need to have as many people on unemployment. But until then, we want to make sure that we're able to process your claim and get you the dollars you need to get by. We have had the most claims for unemployment by a significant factor in our history. Those that qualify have been significantly changed, different groups like independent contractors added to it. And what that's done is taken a system that was designed for something very different and ultimately made a difficult situation, but it's our job to fix that on our end. Every day we are approving more people than we've ever approved. In Kentucky, every day we have more dollars going out than ever before. It's just that there is such a significant surge in claims. It is taking time. Our commitment, though, is we are going to get to everybody. And part of this problem is the system may spit out something saying your claim's under investigation or you've been denied. And as you're waiting for that callback, you may get your first check. That's the problem with having a computer system that's designed to tell independent contractors no when the answer now is yes. But to everybody that has waited, that is struggling, I'll take responsibility. Even with this dramatic surge, our job is to get the job done. We've moved on the call center from having about 8 people to having about 1,000. And our goal, that means, is each and every day we'll be able to help more and more people. So if you're frustrated, I get it. We'll continue to work. Nobody's going to be penalized by the amount of time it takes us, the state, to respond. You'll get your full benefits.
Gotcha. Moving on to benchmarks, you've said the state needs to see a decline in cases for 14 days before Kentucky can start to really open back up. As we start doing more widespread testing, we may see more positive results. Will a decrease in the rate, such as a percentage of tests that come back positive, be acceptable even if the number of cases is still rising?
That's a good question, and the answer is yes, because we are significantly increasing our testing capacity. Starting tomorrow morning, we're in Pikeville and we're in Somerset, we're in Paducah, and we're in Madisonville, and we hope to do 1,000 tests over the next 3 days in each of those locations. That's before you look at U of L's testing capacity that's increased and UK's and all the private labs. So if you look at us having done about 30,000 tests to date that we know about and adding 4,000 in just 4 locations next week, our testing capacity is really ramping up. And Wednesday, I think we're going to have some new announcements about even more testing. And that's one of the other benchmarks. We've got to be able to test a lot more people than we do right now. This 14-day benchmark actually doesn't come from us. It comes from the White House. I was on the phone with Vice President Pence today and other governors, and he reiterated at least 3 times during that call that the White House believes you need 14 days of fewer positives or 14 days of a lower rate. And let's remember, as we think about that curve, and even if we've plateaued a little bit, but a plateau will kind of look like this, where you have an up number and a down number, but overall it averages out. We need to get on the decline. And when we think about the decline from the top point, we need to get a little bit down that slope too. But we can see light at the end of the tunnel. But this isn't like a train moving through a tunnel. This is us walking. through that tunnel. That's what it takes. So there'll be a little more light and a little more light and a little more light each day. But we also, and it's hard, we have to be patient so that we do this right. We do it too early and more people die. That's the result. And my responsibility is to make sure that we do it right. So every day we're working on what it's going to take to meet those benchmarks when we have those 14 days, increasing our testing capacity and our tracing capacity. That's going to require us to hire a lot of people, making sure we have the PPE in our hospital systems and making sure we get plans in, which we've asked now from associations and industry about what their new normal will look like. It won't look like the old normal. None of ours will. You're going to see a lot of people in masks and in gloves in public settings and in business. You're going to see temperature checks every time somebody comes in to a place of business. But we're getting closer to that light. Let's just make sure that we don't move in a way that harms more people than have to be harmed during this virus.
So if you meet the 14-day benchmark by a percentage decrease, not necessarily the total number of case decreases, you would still want to see other benchmarks met too before you started to reopen?
Yes, when we look at the benchmarks, and they're fluid, we've got to make sure that not only is there less of the virus out there, and what that decrease will say is it's not spreading as fast as it had been, that the virus itself is on the decline. But we still need to make sure that we can do things safely. And that's moving forward until there's a vaccine. The last benchmark is the status of a vaccine. Once that's there and widely available, we can go back to something closer to what normal was but before all this. And so we still have to look at, so the virus is on the decline, how can we make sure that this manufacturing site is safer, is engaging in social distancing? And that's going to require all of us to do things a little bit differently. Our testing capacity, we're working on every day. It's increased. It's got to increase more. Our problem is materials. It's not that we don't have enough labs and machines to run them. It's that we got to have the swabs and then the reagents for the machines to get it done. And that's every state. Whether a state makes a decision to reopen this or reopen that, nobody has the materials they need right now for the testing capacity they need. But we do see more materials, at least that are out there every day. And so again, we get a little closer to that light each and every day. We just want to do it safely.
You've said limitations on healthcare may be relaxed in the next couple weeks. Will that be the case even if we haven't hit the 14-day decline? And will that include relaxing restrictions on elective surgeries, chiropractors, et cetera?
So the answer is yes. I believe that we can start easing some of the restrictions on our healthcare field. And it's going to require that we have sufficient PPE on hand, and that's a challenge, but we're getting there. But the other reason for that is that people can still get sick for a lot of other things. And there are a lot of other things out there that can cause people substantial harm. And while we have had to shut down elective procedures and outpatient procedures and regular visits to your doctor's office in person, we've had to do that to prevent a surge in the virus, to ultimately not to flatten the curve, but to truly plateau it. And the people of the Commonwealth of Kentucky have done an incredible job. I mean, they are winning against a deadly virus that spreads like wildfire. That's something truly incredible. But we've got people coming into the ER right now sicker than they would have been if we didn't have to do those steps. So I imagine we'll see a phased approach where we'll look at some services that you can do with minimal amounts of PPE but are necessary. And then, eventually as we move, an outpatient would be the next, because you still have the hospital beds that you need for a surge. But we've got folks out there that need to see their doctor and in instances see them in person. I will say that what we have seen throughout this is kind of an emergence of telehealth at a level that we'd never before seen, and it's been really effective. So the future, even in healthcare, is going to look different.
Gotcha. Another question we got from some readers is why abortion has not been deemed an elective procedure and temporarily prohibited as some other procedures have.
Well, this is one of those issues or causes that can divide a lot of people out there. And I've been committed to not getting involved in any cause or issue that will divide people at a time when we can't be Democrats or Republicans or liberals or conservatives. We can only be Americans versus this coronavirus. I've left it to our public health officials to make the determination of what is or is not an elective procedure. I think that's a medical determination. And I also look out there at this going on in other places and causing division and causing lawsuits. And I'm just not sure that's where we need to be right now.
In terms of reopening, what about non-healthcare related initiatives? You know, businesses like retail stores, dog grooming facilities, hair salons. Given the benchmarks you're trying to hit, are they going to be able to reopen soon? Will it be at least June before they can do that?
What we've got to see is when we are able to have that 14-day decrease. That kind of sets a timeline that people can watch. But we got to be prepared for when we have that. Now, once we know that we are declining, we want to be able to, again, do the gradual phased reopening right away once we believe we've truly seen a decrease in this virus. So now is the time for planning, and that includes through associations, through industry groups, providing us the plans for how they think they can operate under CDC guidelines and how to protect people. And I know every business out there wants it to be safe when they reopen. This has been really hard on so many small business owners and independent contractors. But what I'm amazed about is that people have accepted that it's necessary, that we are more united today than I've ever seen in my lifetime, knowing that we have got to defeat this virus. And defeating it is about doing our reopening well and safely as well. And I know that same commitment that led people to close their doors, knowing they're protecting their fellow human being, makes them want to reopen them safely. So now is the time for that planning. Now's the time for buying the thermometers to do the temperature checks, for thinking about what PPE you would need in your business. Let's make sure when we get that 14-day period in so many different areas, we're ready to go.
Some readers have wanted to know why some bigger chain stores like Walmart's have been able to stay open while smaller retail stores, small businesses have had to close. Any perspective you can offer on that, and on whether the state can offer any aid given that the federal aid is running out fast?
Well, there's been significant issues in the federal Small Business Administration loans, and I feel for those businesses that were counting on those dollars. I am glad that we can provide unemployment, though I know a lot of people are still waiting for that. And I am pushing on the federal level for more dollars through that SBA loan program to try to help people through. We're going to get guidance, should be in about 4 days, on our use of the first money that came in from the federal government, the CARES Act money. And we care deeply about small business in Kentucky. It's where most jobs are created. And we're going to look at every way we can help to get them back on track. The reason that any other store out there is open is if it fits a certain criteria. Some of the stores you mentioned have pharmacies and have groceries, and those are two critical things that people need as they get through this. Household goods, also really important. If we're going to be healthy at home, we've got to be able to repair things in our home or replace things in our home. Now, have our decisions been perfect? Absolutely not. I mean, we're in a difficult situation with a virus spreading fast, and I've had to make decisions very quickly that impact millions of Kentuckians. I've done my best. I'm sure looking back, there will be things I could have done better. I can see that already right now. But I know that the reason that we are where we are in Kentucky is not because of me. It's because of you, the people of Kentucky, taking this as your duty and doing a phenomenal job. I am so incredibly proud of you.
In terms of education, obviously what's happening with schools is a big question for a lot of families. You've got a call scheduled today with superintendents around the state. What will you be talking about?
Well, I want to make sure I talk to the superintendents first. But I'd say even in the White House guidance, even when we move into phase one of a gradual phased reopening, their strong recommendation is that schools remain closed and daycare options remain closed. So let's remember that while children don't appear to show significant symptoms of COVID-19, and we've had very few fatalities among children. And being the dad of a 9 and a 10-year-old, that's one of the few things that brings me peace during this. We've also seen that they do get infected, and it's much harder to enforce social distancing amongst our kids. And so the activities and group activities with children, we're going to have to be very careful about because of how many contacts can come together and spread back out. I'm not sure my daughter's going to forgive me for that, but we got to do it in a safe way.
I got two last questions for you. Dr. Stephen Stack has said that the state may need to test 9,000 to 13,000 people per day to most effectively deal with the coronavirus. How feasible is it for the state to ramp up testing to meet that mark? And will hitting that mark be necessary before the state advances to a certain phase of reopening?
So we're gonna look at all of the benchmarks together. Now, if we haven't hit, well, the 14-day benchmark we have to hit. The White House is very clear on that. But the other ones we can look at a combination of. In other words, if we believe that a business has a really good plan to meet the CDC guidelines, and at the same time we have significant testing, but maybe have not quite reached that point, there's going to be some real flexibility there. That's why these are benchmarks that we look at. And it's going to be gradual. It'll probably be industry by industry or association group by association group, because there are some businesses that just have less interpersonal contact than others. And that's not going to be driven by anything other than how this virus works and how we have to respond to it. We have significant more testing capacity with partners like Courier, and I think we're going to have some more partners here soon. Gravity Diagnostics has been a godsend, as have U of L and UK in increasing our testing. We need a lot more to make sure that we can do things safely and get back to the point where if you test positive, we can go out and test everybody around you that has been in contact with you. If we can get to that point, we can get a lot closer to a normal, which again is a new normal.
One thing you mentioned sparked another question. Businesses are really eager to get back opened up, rehire folks. Should they be reaching out to you, to the state with, hey, here's my plan for safety, or reaching out to the local public health departments, on an individual level, or should they just let industry associations have that?
On Tuesday, we're going to announce our team that's going to be accepting those plans. And it's going to be a system where they can provide a little bit of back and forth, and then the plans will go to our Commissioner of Public Health for comment on that. And I believe it'll be a back and forth with various groups, but the better the plan is, the fewer contacts there are, then the better spot we'll be in to get going. We have done such a great job in fighting the virus, and because of that, there are so many more people, I believe, not just in the hundreds, but in the thousands that are still with us that otherwise would have died. Let's not start taking it easy at halftime. We had the largest number of cases that we've announced yesterday. Let's make sure that we are thoughtful, resilient, strong, and committed, even as we're planning on how to come out of this, to keep doing the right things, to stay healthy at home, to not spread our contacts, to protect our senior living facilities, and ultimately be the type of great Kentuckians that we are.
One last question for you. A few readers reached out. They're planning to get married in late June, and they want to know, should they postpone that, or will the phased reopening allow them to have that big summer wedding that they've been planning and counting on?
This is one of those hard parts of a virus like this. Whoever thought that the challenge to our times would prevent us from coming together and celebrating those moments in person? Obviously, right now, if we still have the rate of cases that we do at the moment, any type of mass gathering, even if it's a special occasion like a wedding, we can't do. Just like those birthdays we see, especially we saw someone with their 100th birthday, and we had family outside trying to celebrate with them, but not being able to be there. Even in a phased reopening, in phase one, once we hit it, it's groups of no more than 10 people. And so people ought to be real thoughtful of that. And here's the other thing, and I mean, from somebody who has been married very happily now for 14 years, April 1st, April Fool's Day, is our wedding anniversary. A wedding right now is going to be really different. And so if you're thinking about it, understand that people are going to have to be wearing masks and once we get to that point. And that standing real close together for that big wedding picture is going to be really difficult. So, I'd like everybody to think through it, to think about how they could do it. If you could do a virtual wedding, I know that's not what you want to do, but for the next month or two at least with the size that most of them are, that's probably the option you ought to consider. Hopefully, as we move into the fall, we'll have some better options. But again, our new normal will look and it'll probably feel a little different.
Well, Governor Beshear, I really appreciate you doing this. I'm sure our readers do. Anything you want to close with?
I just want to say thank you to everybody. Thank you for your work. Thank you for your sacrifice. Thank you for being willing to stay healthy at home. Who would have ever thought that we would face a worldwide health pandemic? And who would have thought that the response to that would rely on every single Kentuckian being the best person and the best neighbor that they could be, that each and every one of our actions could keep someone else safe or could expose them to harm. And I know in a cable news type of world, you see a whole lot of attention to the couple dozen people that don't want to do their part or don't believe it's real. That is not how our history will be written. Our history will be that this generation came together, putting the lives of our fellow human being above our own economic security, that we were asked to do something that no generation had ever done, at least in my lifetime, and we did it selflessly. We are showing what type of good people we are, pushing the divisions aside and coming together. And my hope is we don't just defeat this virus and do the smart thing about how we reopen and eventually get a vaccine and get back to the old normal, but I don't want the old normal of division and anger and our fellow human being not being kind or supportive to each other. I hope when we reach something closer to an old normal, it's our ability to see each other and hug each other and have those weddings and do those things. But I hope we continue to keep the type of compassion that I see every night with green lights all over Kentucky, the type of compassion I see with people shopping for seniors, with their groceries, with schools coming together and providing meals for kids. I have seen more positive humanity during this, and it's humbling. So let's make sure whatever our new normal is, we continue to be the type of great people that we have been as we have worked to defeat this virus. Thank you all very much.
Thanks so much. Hopefully we can do this again sometime soon for our readers, and in the meantime, stay safe.
You too, and to everybody else out there, we'll get through it together.
Thanks.